Hi, my name is Dr. Rachel Owner, and today I am presenting pediatric anxiety and how to support your infant with anxiety. Okay, so this is me. I am a naturopathic doctor, and my focus is in pediatric and family healthcare. Disclaimer at the bottom, this is medical information from Baby Mama's Doula, and it's provided as informational resource only and not to be used as any diagnostic or treatment purposes. Information on Baby Mama's Doula does not create a patient-physician relationship and should not be used as a substitute for professional diagnosis and treatment. Okay, so what is anxiety? Anxiety is a response to stress or fear, which can affect both adults and children. So there are many different types of anxiety based on the DSM-5 criteria. So social anxiety is when you have an intense fear of being embarrassed or rejected in front of others. Separation anxiety, afraid being away from their caregivers. Generalized anxiety, worrying too much too often about too many things. Panic attacks, which is experience unexpected panic attacks that come on suddenly. Um, Obsessive compulsive disorder also falls under anxiety, which is having unwanted thoughts and repetitive actions to calm anxiety caused by their obsessions. And specific phobias. So sometimes children have phobias, which is an intense irrational fear of a specific object or situation. So, what are the signs and symptoms that your child has anxiety? Sometimes it manifests as physical symptoms. So, you'll see like tummy aches, headaches, tiredness, shortness of breath, fast heartbeat, frequent urination. Sometimes they have emotional responses such as nervousness, outbursts, crying often, lacking confidence, having negative thoughts, or behavioral changes such as clinginess, fidgety, shaking or jittery, withdrawn, avoiding activities, not sleeping, and not eating. What are the causes of pediatric anxiety? So sometimes stressful life events happen, like moving homes or schools frequently, death of a loved one, or even a pet, serious illnesses or injuries, bullying, parents fighting, divorce or separation of parents, trauma and or abuse, learned behaviors. So if they are around anxious people, then they develop it. Parents who are overprotective, or model their own fears may increase their child's risk of anxiety. And then also medical. So studies have found that children with ADHD or on the autistic spectrum disorder are most likely to have anxiety. Genetics also plays a role. If a lot of family members have anxiety, there is a genetic link to children also inheriting those genes. And then even adrenal disorders, so thyroid, Addison's, Cushing disease, can cause anxiety and other physical and mental health problems. How common is pediatric anxiety? So, 1 in 8 children experience childhood anxiety disorders. Between the ages of 13 and 18 years old, 25% of children have anxiety, and then 5.9% of children actually develop severe anxiety. What happens if pediatric anxiety becomes untreated? Social development is affected, so difficulty making friends, social isolations, and avoiding group activities. Academic and work is impacted, so trouble focusing, low performance, or refusal to even attend school or work. And then long term chronic stress, depression, other mental health issues in adulthood, anxiety in adulthood, and increased likelihood of having a substance abuse problem. So this picture is kind of when it rains, it pours. So that's the analogy that I put here when pediatric anxiety becomes untreated. So there's many things you can do to test for pediatric anxiety, get a psychiatric evaluation. Naturopathically, there's a few things that I like to do, such as the organic acids test. It kind of shows you what's going on a cellular level. Neurotransmitter testing is a bit more specific, where it kind of looks at the different neurotransmitters, see if they are off. Blood work. So these are the blood work that both conventional doctors and naturopaths can test. So looking at CBC, B12, iron, vitamin D, liver functioning tests, thyroid, fasting glucose, cholesterol, HbA1c, markers of inflammation such as CRP and ESR, and cortisol AM. One thing that is missing here is electrolytes. That's also another thing to look at too. And then lastly, a GI stool test. So when you start to see physical manifestations of like a tummy ache, not feeling well, then I like to also do a GI stool test. Half of the neurotransmitters are actually made in your gut. So when they're off, especially if there's bacterial dysbiosis, then you tend to see kids have more anxiety. So support. Parents, teachers, caregivers, here are some things that you can do to kind of help support your kids outside of a healthcare professional. So encourage open communication and validation of their feelings, maintain consistent routines to provide a sense of stability, encourage small steps to overcome fears, and provide praise for efforts, avoid overprotecting, allow children to face mild discomfort in a controlled way. Now, looking into what conventional medical doctors typically do, first line therapy for pediatric anxiety is cognitive behavioral therapy. So that's usually the first line. There's play therapy, exposure therapy that may be added in by a therapist if they find that that is warranted. Speak to a therapist if you do find that CBT is not doing everything that you're looking for. And then also medications such as SSRIs may be administered if the anxiety is prolonged or if they are still not being treated by CBT or play therapy. So this is the best time to contact your family provider and make sure that they're getting the necessary help. So naturopathic treatment, there's a lot that we can do, especially with the testing. If testing shows that there are things that are off, then you definitely want to correct them, such as like if they have low iron, if they have low vitamin D, low B vitamins, then you definitely want to supplement there. Other supplements such as omega-3 fish oils, neurotransmitters such as glycine, GABA, and lysine may be administered. Herbs, ginger, lavender, passion flower, and chamomile. These are my top 4 herbs that I like to recommend. Nutrition plays a big role. Like I said, gut, most of your neurotransmitters are made inside the gut. So making sure that nutrition is balanced is very important. So reducing refined sugars, juices, pop, increasing protein, fats, fruits, and veggies, where you get a lot of your vitamins and minerals, things that kind of help brain health. Making sure that your macronutrients for your child is balanced. That's also another thing. And then physical things such as acupuncture is really, really helpful. Massage, exercise, outdoor therapy. These are a lot of naturopathic treatments that I like to recommend. Do speak to a naturopathic doctor if you are looking for support, because naturopathic doctors, not all of these will be beneficial for your kid. You really want to make sure that you are targeting your approach, getting the appropriate dose, getting the appropriate timing, how long they should be taking it for. Everything will be assessed on an individual basis. So you want to definitely speak to your naturopath to make sure that you're getting the correct natural and holistic support. So now I'm going to go into mindfulness techniques. This will also be posted in the Baby Mamas community as a little handout that you can download and keep with you. So the first is box breathing. I find box breathing to be very beneficial with reducing anxiety. I recommend it for both kids and adults. So basically, you're going to be basically visualizing a box. You're going to breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and hold for 4 seconds. And repeat that cycle until you are feeling a lot more relaxed. The benefits of box breathing is it helps calm the nervous system and reduce stress, helps return breathing to a normal pattern, and improves abdominal control, awareness, and increases overall respiratory support. The next mindfulness technique is belly breathing. So what you can do, I like to do more of the bottom approach where you just sit legs crossed, breathe in fully, hold for 4 seconds, exhale fully, hold for 4 seconds, and repeat until fully relaxed. And basically your kids' hands are going to be on their belly and they're going to feel their belly kind of expand like a balloon, and in and out. That's kind of the visualization that you want to have while doing the belly breathing. The top one's a little bit more fun. one where you can also put a stuffed animal on your child's belly and they can watch it kind of go up and down like a wave. So both instructions will be there in the handout. Next is finger tapping. So what you'll do is have your child sit on the floor or chair and they'll tap their fingers at once, and then you're going to then tell them to tap their fingers 5 times. Then you're going to say their pointer finger, you're going to tap for 5 times. Then in the next rounds, they're going to do each set of fingers and be finger tapping for 6 times. And you're going to continue this until you get to a round of 10 times. The benefits of finger tapping is to calm the nervous system and reduce stress, and it also helps regain focus. Next is the progressive relaxation technique. So this can be performed either lying down or seated, and you're going to tell your child to start paying attention to their feet, squeeze your feet and then relax them, move up to your legs and squeeze your lower legs, then relax them. And you're just going to be moving all the way up until they get to their face, and it's going to be like kind of holding and releasing. And the point of this is to kind of release tension out of their body. So you're going to continue this until they are feeling relaxed, especially if you do this around bedtime. It's a great time. It kind of helps them just, fall asleep a lot better. So this is when I like to kind of recommend the progressive relaxation technique. And then the final one would be walking meditation. So this can be performed indoors or outdoors. Basically, they're going to begin the exercise by asking your child to walk as fast as they can with 10 to 20 steps in one direction and then back. And then you're going to tell them to slow down their walking until they are walking as slowly as they can. I prefer this to be done outdoors. Outdoors has a lot of benefits with kind of regulating anxiety and stress, and it helps calm the nervous system down. The benefits of this walking meditation is to calm the nervous system and reduce stress, like the other ones, to help disperse energy, teaches mindfulness, and improves physical health. So that's the end of this lecture today. This lecture was brought on by Baby Mama's Doula. If you want to stay in touch, you can visit the website babymamasdoula.com. Our email is babymamasdoula@gmail.com. So if you have any questions, looking for holistic support, and our Instagram is also Baby Mama's Doula. Thank you.